We are making a difference.
We are making a difference.
We are making a difference.
We are making a
Nous agissons
difference.
pour un monde
We
meilleur.
are making a difference.
We are making,
We are making a difference.
We are making a difference.
We are making a difference.
My name is Garth Tohms. I'm a technician with the Canadian Red Cross's Emergency Response Unit. As Canadians, and as the Red Cross in general, we worked with the Sierra Leone Red Cross, the Ministry of Health, and other agencies on the ground to get the word out about Ebola, to let them know that it's not a death sentence. As a member of the Emergency Response Unit, I'm one of the first people they call when there are really tough missions because I tend to have a lot of flexibility in my schedule. So the Red Cross put out a call for technicians to go, and as soon as I heard, I jumped at the chance. Ebola's, it's not only the disease of the virus itself that is hurtful to these areas, but it's the impact that it has. It's affecting the areas socially, it's destroying their healthcare system. A lot of doctors and nurses and other healthcare workers have died from being in contact with it. A lot of these countries already had very poor health infrastructure to begin with. So what was happening is it was destroying the health infrastructure. People would not go to hospitals for fear of getting Ebola because the patients that were there. So people were dying of treatable diseases, malaria, Lassa fever, even measles. So the idea of the ETCs, the treatment centers, was to get those Ebola patients away from those hospitals so they could carry on and do what they needed to do. And then there's also the stigma. When I arrived, the hospital had been open for 2 days. We only had 4 patients, and we have the Ebola Treatment Center, which is outside of Kenema, Sierra Leone. It's about 17 kilometers from the city. And it's one of many treatment centers in the country. Most of the other ones were run by Médecins Sans Frontières. So I was actually rushed to the center because what was needed at the time was not medical staff, but technical staff who could work in infection control and address a lot of the technical problems we were having when the center first opened. Because no matter how much we tried to anticipate things that would happen with patient flow, triage, and that kind of thing, a lot of things arose when we actually went live. A lot of the mechanical stuff failed due to the concentration of chlorine and other mechanical things we were having problems with, so we really needed to address that. We were able to do a lot of outreach and get the word out about Ebola, that it is real and that people can survive it. It's not a death sentence if they can make it to an Ebola treatment center. And we saw immediate effects of that with one of our first patients that came in. We got a group of 4 when we first opened, and 2 weeks later, an 11-year-old girl, Kariatu, walked away Ebola-free. And that was a huge, it was a huge step forward in the fight because it showed the locals that it's not a death sentence. I think it's great that the government has come forward with a lot of support for us, especially lately. They're really helping us find staff, which is imperative. We need a lot of staff still in this response. They've come forward with a lot of donations, not just for the Red Cross, but for also MSF and other organizations who are working on the ground. And I think that's great, and I hope they continue to support us as it goes on. So we met Joseph, the gentleman in the picture. He's a local artist, well-known artist in Kenema, and we contracted him to paint a mural that would convey hope for the people that were in the center. And he came up with a typical village scene that you might see in any given village within Sierra Leone. And you can see there's people making supper in it and fishing and doing normal daily activities. I think I made a difference because I watched people walk away from that hospital that we never thought would walk away. And Ebola is strange because people would come in and you'd look at one person and they would be listless, like Kariatu. When she first came in, she had no energy. She could barely walk. 2 weeks later, she was walking out happy under her own power. You can see the pictures of her on our website. I'm Garth Tohms, and we at the Red Cross are making a difference.